Good morning, dear Mr. Roy Cooper. The purpose of this letter is to thank you for the action taken on your behalf in the STOP Act 2017 Strengthening Opioid Misuse Prevention Act recently passed on July 1st, 2017. In light of the growing epidemic, even from 2017 to March of the current year, 2018, the epidemic is not slowing. Many of the sections of the STOP Act don't go into effect until 2020. This is leaving much of our North Carolinians still vulnerable and under the influences of opioid addiction and dying daily. I realize that this has been an ongoing health disparity for many minorities in our state for years, but now that it is a fast-growing epidemic or crisis for the white suburbia like myself, I feel I should use the platform to make the change that should have been addressed long ago, instead of ignoring it because it didn't really affect white people. Now the epidemic is out of control and the number of white people dying is exceedingly high. It is a concerning topic. According to the CDC's estimates, the cost of unintentional opioid-related deaths in North Carolina totaled $1.3 billion in 2015, and there has been more than 12,000 deaths due to opioid-related overdoses from 1999 to 2016. The problem with opioids is that it doesn't discriminate. It goes across all socioeconomical classes, races, ages, and sexes. There is not a typical or stereotypical person that deals with the problems of opioid-related issues, addictions, or deaths. I feel that along with your limit on the prescription to 5 days for acute pains and 7 days for post-surgery procedures with opioids in the STOP Act, that we need to look at the treatment areas for those already addicted. I feel North Carolina as a whole should be invested in treatment centers, but as of right now, there's only 66 treatment or prevention centers in the whole state. That is less than one per county. We have left almost half of our state unattended and lacking the access to care that should be provided to them. The reason this is so important to our state is because of the economical struggles that we're going through, the associated health care costs, and the loss of production and jobs due to unintended misuse of the opioids, and how staggering the numbers are with no end in sight. I call for more action. We're headed in the right direction, but we are failing our fellow North Carolinians by only taking baby steps on an issue that's had giant leaps ahead of us for decades now. I've attached data sources by the Medication-Assisted Treatment for Substance Use Disorders that show the counties that are lacking access, and the CDC site has a substantial list of patient deaths and emergency-related issues concerning opioids, and feel we should look at those numbers and compare and see where we need to be going. Thank you for your time and attention to this matter, and I appreciate it. Christy Kirkland.